I'm looking up, it's because I'm looking up at my screen. All right. Hello, everyone. Welcome in. Come on in. Come on in. We are going to get started. I'll just give it one more minute and we'll get started. All right, let's go ahead and kick this off. Hello, everyone. Uh, Thank you so much for being here today. My name is Simone Davis, and I am the Annual Giving and Database Manager here at WREN. So I work closely with our community of supporters, and so it's really meaningful to be in a space with you all today. So if you are here, you know that today's conversation is something simple but very powerful here at WREN, and it's how we show up in the moments that matter. So here at WREN, we're working every day to advance policies that impact women, girls, and families across South Carolina, and from access to healthcare to economic security and beyond. All right. So, a little housekeeping before we dive into everything. All right. So this webinar is being recorded, just so you know. The chat may only be used by our co-host to share important links, contact information, and so forth. And audience members are welcome to submit questions and we'll answer them at the end of the webinar. We have our webinar DJ, as we like to call them. We have Katie. And so live captions are also available. If you look at the icon, you're able to enable them in the control panel at the bottom of the Zoom video. All right. Next slide. All right. So we today we have Dr. Beth Cook joining us. We are so grateful for her to be here. And we want to let Beth just do a little intro to herself. I'd love for you to introduce yourself, Beth, and just share a little bit about yourself and what brought you to this work.
Thanks, Simone, and thank you all for having me today. I appreciate the opportunity to talk with folks about what an impact WREN's had for me. I'm a board certified OB, as it says. I've been in private practice since I finished residency back in 2002. I've been in South Carolina practicing that entire time. I've got 2 locations and serve a lot of women here in the Low Country area. Been doing both obstetrics, gynecology. So these issues that have escalated over the last several years have increased my sensitivity to what's going on. And I was looking for a channel, an outlet, a way to kind of get out and fight against the things that I think are impacting my patients, making my patients not safe and presenting issues for them. So I am very busy often and got to a stage in my career where I felt like, okay, I have a little time that I can create and dedicate to be a part of something. So when I was investigating organizations, I kind of felt like there's a lot of groups that are doing a lot of good work and combating things at individual levels are one topic. But in looking at things, I felt like WREN offers the total package. Women, girls, families, all the legislation that's going to have impact on us and the people we care about, and doing that at a level that is trying to prevent that from being something we then have to react to. So I felt like for my energy and for my purposes, it was the best umbrella and was doing it at an advocacy level, organizing level, trying to get people out, trying to get voices heard, trying to make sure we're aware of what's going on. And when I kind of whittled down, like, where would I like to be? WREN was the place where I felt like this is where I'd like to be a part of. And I've been a supporter of WREN in the past, but again, over the years, getting more exposure and learning more about what they're doing, it paralleled so much with what I was looking for. So it keeps me from doom scrolling and it gives me a chance to channel my energy positively.
All right, thank you so much for sharing that, Beth. And Beth is, she's not just a supporter of WREN, broadly. She's on the board of WREN. And so she's very helpful in really being a source, a resource, and an expert in her field, which is, very helpful to us. Um, all right. And so just a little more about myself. My name is Simone Davis. And I work here at WREN. I am the annual giving and database manager here. My love for being a problem solver, a builder of data, and an advocate for equity, and using that data to storytell and make community connections is what brought me here to WREN. So I do some fundraising, um, annual fund management, cultivating donors. But one of the things that I love doing most is working in our database systems. All right. So we are just going to tell you a little bit more about what the objectives are here. And I think myself, Beth, you don't have to, but I'll likely go off camera just so I can, it's not a distraction, and go through the PowerPoints. All right, so today we're going to talk about who we are, what Midlands Gives is. Um, You've already heard a little bit from our special guest, who is Dr. Beth Cook, and we'll also make a little announcement, a special announcement towards the end, which I'm very excited about myself, and how it works, and just some resources we'll give you also at the end of this webinar. All right. So I am going to take my video off so I can take you guys through the presentation. All right, so who we are, who is WREN? All right, uh, WREN stands for Women's Rights and Empowerment Network. All right, and here at WREN, we're working every day to advance policies that impact women and girls and families across South Carolina, from access to healthcare to economic security and beyond. And this is just a little bit about WREN's mission, right? So part of our mission is to advocate, educate, research, and convene. And so what we say is we advocate, we educate, research, convene community in service to women and girls for a more equitable South Carolina. And I'm really glad that Beth is here today, to talk a little bit about that. I'm really excited that you're here, because your leadership and your perspective brings this work to life in such a powerful way. And Dr. Cook, you've been involved with WREN as a supporter and now as a board member, as I mentioned. Can you share a little more about what first drew you to this work?
Sure. I really feel like being involved, being able to feel like you're doing something active in the process where you feel like women, girls, families are being targeted in a lot of situations, and being able to find an organization that prioritizes that meant a lot to me. I'm in a situation every week where I'm facing very serious medical decisions with patients, and other
Mm,
decisions about things we can do to make procedures more comfortable for them, and situations that may arise that are difficult for patients and even life-threatening for patients. And what I
mhm,
started to see were a lot of things that were going to highly impact that, and they were taking away the rights of my patients, and they were taking away our ability to even safely be able to treat and manage those patients. And with that in mind, I took an oath when I graduated from medical school to do no harm, the Hippocratic Oath. And
mhm,
if I'm in a situation where I have a patient that's experiencing tremendous blood loss and their life is at risk and they're having a miscarriage at 3 in the morning, I can't call a judge and ask, hey, is it
Mm-hmm.
okay if I do a D&C on this patient, which is also known
Mm-hmm.
as an abortion. And so the more I read about some of the insanity that's embedded within a lot of these bills that are being introduced, and I felt like I had specialized knowledge in this area, I really wanted to channel that energy into something positive and try to fight against that and try to create awareness and make sure that people are in tune with how that's going to impact things that might be going on in their lives or the lives of their loved ones. And, you know, a lot of personal experiences with that. And again, this isn't like, oh, that happens once in a blue moon. For me, these are events that occur every week, if not nearly every day of my practice. And I
Mm-hmm.
wanted to find somewhere positive and somewhere I could take that passion and work with an organization, not just as a donor, but as a member of the board as well. So, Ren,
Mm-hmm.
at the very first meeting, I was just so impressed with the organization, the leadership, the character of the people that are involved, and the experiences they had. You know, just hearing about everyone's backgrounds and what they've done and what they've been involved in advocacy wise and what kind of humanitarian projects they've done. It's really a top notch organization from the top down, the board members, the leadership team, all the employees at WREN. I've just been thoroughly impressed with everybody there and felt like these are people that I want to align with. And so now serving as a board member, and again, in the past, I did a lot of different interviews and different
Mm-hmm.
bills would be introduced, and they would need somebody to speak on the impact of that. So now, as a board member, I'm happy to be able to jump in at a higher level and participate at a higher level and get the word out and try to get more people involved and more people educated about what's going on around us and what kinds of things we're being put at risk for. Um,
Yeah, yeah. And thank you so much for giving those examples and like sort of anchoring that into real life. And you talked a little bit about, you know, uh some of REN's, our legislative priorities, and one of those things is, reproductive freedom, which you kind of touched on. And I think you bring a very unique perspective, especially as a physician that works directly, um, with patients. Um, and when we talk about, I skipped a slide, I apologize. When we talk about reproductive freedom and we talk about also economic justice, those are some of REN's legislative, priorities. When we talk about economic justice, we're talking about uh, who should have when you have a fair chance to earn money, to have a job and to just live a good life. Are you able to access the resources that you need to have a good life? And when we talk about reproductive freedom, we're talking about the full range of autonomy options. And I know that, you know, you touched on your patients being able to have that level of autonomy, whether they're able to make decisions about, their own body, their future. And so here at REN, um, we do a lot of work around those things, and those are our priorities: protecting access to abortion, protecting access to IVF, and improving access to doula, and lactation services. With that said, Dr. Beth, you see firsthand how those policy decisions show up in people's lives. What would you say is the most concerning? Or I should ask, what are you seeing right now that concerns you most?
yeah, I would say the overall picture of those of us that may be more vulnerable as women or women with children or women of reproductive age or families having the capacity to both be working full time and take care of their families. all
Mm-hmm.
of that, I just feel as if the most vulnerable people are being targeted and they
Mm-hmm.
need support. They need others to help fight for their rights and try to provide for them. I spoke at an interview several months back on the Family and Medical Leave Act for women that experience, for example, intrauterine fetal demise, meaning they're carrying a pregnancy and oftentimes it's later in the pregnancy and they discover for some reason the baby is no longer alive. And
Mm.
it's devastating. Here you've
Right.
got a lot of hopes and dreams for that, and you're 32 weeks along. You've already decorated a nursery, you've already prepared for this baby,
Yeah.
and something devastating happens. They were
Mm.
only wanting to give 2 weeks off for those women to recover
Mm.
from a full birth. And that was compounded by the fact that you're going to be going through a devastating emotional time. You're going to be going home from the hospital after delivering in a very horrid circumstance and dealing with a lot emotionally, but somehow you're supposed to get it together and be back to work in 2 weeks. And I just felt like this is crazy. They've still gone through
Mm.
that full process. They've still had the whole experience coupled with coming home and being confronted with all of the hopes and dreams they had for that child that's no longer with them. And again, you're very vulnerable in that situation, both emotionally and medically. And I
Mm-hmm.
just felt like I can't believe that they're trying to make this a 2 week and come back to work thing. So
Yeah.
I really felt like there's no educated input into a lot of these decisions. There's nobody, for example, like myself, that's involved when they're drafting this. There's nobody involved that has the understanding from a medical perspective. Um,
Mm-hmm.
and so I think just getting our voices out there as well and demonstrating that, you know, you're making bills and introducing things that you don't really have a foundation of knowledge about, yet you're not involving the people that do have the knowledge. So with WREN, we at least have that capacity to try to identify those areas where we can focus on
Right.
it and, work with our folks in the communities and figure out what are the items of concern that are coming up so that we can prepare for those and we can try to be involved in that process and try to educate and get that information out and try to build those relationships with the people who are on the legislative side of things to help bring some knowledge to them as well. So that's kind of
Precisely.
where I felt like I've got a role here and I want to fulfill
Mm-hmm.
that by being a part of this.
Yeah, and I want to touch back on and Katie, our chat monitor, I might bring her in maybe to explain a little better. You just talked about, one of your patients that, might only get 2 weeks off, um, after giving birth or learning of that. And Katie, I know SB 11, there was some movement with that over this week. Can you maybe, I feel like that kind of ties in a little bit. Um, and I hate to put you on the spot, but just explain a
Oh,
little bit about that
I
bill
am
and
I
yeah,
am always
and what
ready
it does.
to talk about a policy. Put me in, coach. Um,
Yes.
yes. So the first thing I want to talk about with that scenario, Dr. Cook, I think, you know, we don't want to get lost in the fact that like storytelling is so important, right? So like I first want to say this whole conversation started, the whole paid leave conversation started when a legislator noticed that his staff could not take off after they give birth. They were saving up their paid leave days, and he was like, "What are you doing here?" And she's like, "I can't take off. I have to save all my days until after my pregnancy." And he
He
was
was
like disgusted, right? So he that pushed that policy through, and that's how we were able to get that 6 weeks paid parental leave um, for state employees. This year, we want to take it a step further. We want to increase that from 6 to 12, and then also provide 4 weeks of paid leave to the, I'm going to say this phrase, I don't like it, but I'm going to say it's like non-dominant parent,
Mhm.
the parent that did not have a pregnancy. And also on this, so we're increasing the weeks. We are also making it really clear that a stillbirth event still qualifies for these benefits. There were some teachers that we like met up with over the summer, and again want to emphasize storytelling. They told their story. They were like, "Hey, I had a stillbirth event. I was not granted paid leave, and I, like Dr. Cook said, that's like a whole that
Yeah.
is a pregnancy, with the pain at the end without having the child, and so it's a really painful time, and of course they deserve that paid leave. So Senate Bill 11 increases those weeks. It makes it very clear that this includes a stillbirth event. And then it also expands the eligibility to all state employees. When the original bill was drafted, there was just a little bit of a technicality thing where grant employees were being left off. So we're really excited about Senate Bill 11. It's so close, y'all. It's so close. It got out of full committee yesterday on the House side. So it started in the Senate. We're at full committee on the House side, which means we've crossed over. It needs to go to the floor. We would need to have a conference committee just so because there were changes between the two versions, and then it would go to the governor. And guys, we are so close. And I'm gonna put the action link to it. Just if you feel so inclined, please
Yes.
write to your House rep. Um, but thank you for letting me do that spotlight there, Simone.
Oh, of course. Thank you.
I cannot say it enough. Your stories drive advocacy. Storytelling is the most
Mhm.
powerful tool you have. So,
Yes. Thank you so
my,
much,
of
Katie. I,
course.
I appreciate that. And speaking on that, what Dr. Cook and what Katie is talking about, people like that, you know, on the WREN staff and other supporters uh are really the driving force. And a lot of this is possible because of, you know, advocate support, but also, donor support because um, we are able to respond in real time uh, to, the legislations that come through, going across the state to, talk to college students or, um, you know, doing advocacy one-on-one letter writing workshops. And a lot of those things are made possible because of, donations and supporters, which brings us here why we're here today to talk about one of the campaigns we have going on right now, which is Midlands Gives, right? So Midlands Gives it's more than just a giving day, even though it is a giving day. It's a little more. So it's a moment for change, right? And it's one of the biggest moments each year where people across the state invest in the kind of South Carolina that they want to live in. It's a chance to collectively say that this is the work that matters. It's also a platform where supporters can invest in organizations. And it's just a moment to come together to build a more equitable South Carolina. And during Midlands Give, there's something going on right now called early giving. And early giving started on April 1st. And we've been doing a lot of campaigning around that. Um, and this is how it works. So donors can search and give to nonprofits We would love that if that nonprofit is WREN, although we we support everyone. But you can give to the nonprofit of your choice. All right. So what your nonprofit does is they create a profile, they can tell their story. Your supporters can create individual campaigns. Two of the campaigns we currently have going um, on top of our regular Midlands Day campaign is doctors for Midlands for WREN, sorry, doctors for WREN, and also have lawyers for WREN. So these are specialized groups that are very resourceful, important to the work that we do that really are helpful in informing the work that we do. And so we want you to know that there are many ways to engage in this work. And the early giving all kind of commences into the giving day, which is the first day, the first Tuesday in May. This May, it is May the 5th. And that is when the giving day starts. And so during Midlands Gives, there are matches and prizes that help to stretch every dollar further. And these prizes and these matching funds, they help boost the donations that happen here. Um, so, Dr. Beth, I do want to ask you, with these ways to engage in our work, there are so many. Um, what makes this organization, WREN, effective from your point of view?
I think the main thing for me was with the platform you have and a multi-pronged approach, I felt like you have the ability to make the highest impact for the dollars that I'm donating. Years ago, before medical school, I worked for a United Way and was involved in, working with all the agencies and things. And so each agency had its own small piece of things that it was working on. But with WREN, because you have several different facets of involving the community, of keeping an eye on the legislation, of networking and offering resources, I felt like you were the total package. So
Mhm,
when I'm making my contributions, I like to feel like one, it's going to have an impact on the things that I'm passionate about. But two, it's going to be an efficiently used gift. It's going to
mhm,
help hopefully prevent some of the things that we're now having to fight against. And so through that
mhm,
proaction, um, through y'all's vision, I just felt like if I'm going to give money somewhere, I want to give it to RIM because I feel like they're going to stretch that dollar. They're going to do everything they can
mhm,
to help the things that I'm most passionate about. And I think many women are in the same situation right now where
mhm,
you're being affected from a lot of different angles and you're trying to protect your family and your children and yourself. And I think when you're looking for that outlet for giving, Ren kind of rose to the top for me, and I felt
mhm,
strongly about it and was really wanting to put a gift in that would give an opportunity to challenge other physicians and even,
mhm,
physician assistant, nurse practitioners, folks who are serving patients and they see the impacts of all the things upon these patients. One, just through letting them know, hey, I'm someone and I feel strongly about this. But two, also challenging because in many cases, people may have time that they can dedicate, but when you are patient facing and
mhm,
you're working all day, every day, you may not have a lot of ancillary time to come out and donate as
mhm,
a board
mhm,
member or to be present at
mhm.
an event. And so, if you don't have your time that you can give, you want to make sure the money that you give is having the highest yield for your dollar.
Correct. Yeah, thank you for sharing that. And so it things like that matter because it helps to power REN, to power our research, our advocacy, our community engagement. Um, Helps us to work towards the systems that are impacting women and girls. One of which that Katie spoke on earlier. helps us to expand and allows us to stay in the rooms, rooms where Katie is a lot, and Ashley Crary, our strategic partnerships person. Um, they are in the rooms where decisions are being made, and making sure those our communities are represented, right? And so um, I want to take a moment here to say something, really important. So, Dr. Cook, you have made the decision to really deepen your investment in REN in a very significant way this year. And before we share a little more, I'd love for you to talk a little more about what led you to that decision, and can you share why it was important for you to make that commitment now during Midlands Gives?
Well, during previous giving, like I said, I always would do research and
Hmm.
investigate and kind of make sure that I felt good about where my contributions would be going. And the
Hmm.
more familiarity I gained about REN and now being on the board and seeing the caliber of the people that are executing these strategies and seeing the character and the quality of the people that are involved, I really felt strongly about REN as being a high priority. The higher level of support and channeling more of my giving for REN was because we are under assault right now.
Yeah.
Women and our daughters and our families, and nobody's going to save us. We have to save
Hmm.
ourselves. And at this moment in time, I felt compelled to try to do as much as I could to try to help and to try to fight the things that are trying to take those rights away from us and the programs that they're removing. And so I felt like this is a time because it's bad.
Hmm.
Things are not great for us right now. There's a lot of different things, and it's not that we aren't having our victories, we are, but I
Hmm.
wanted to support an organization that has that high level impact and has the most likelihood of helping us fight through this time to maintain our rights and to try to maintain the programs and the resources that people need. And I didn't feel like this was something to put off. I felt like now is the time
Hmm.
to do this. And that's kind of what gave me that impetus to get on a board as well. I was like,
Hmm.
oh, this is something I would be very interested in because I really feel like I need to channel that energy and that passion
Hmm.
towards something that matters. So, with that in mind, I felt like it's now. We need to do
Yeah.
this. We are a target right now and we need to protect ourselves.
Yeah, yeah, you said something very powerful. We are under assault, which
Hmm.
is it which is the feeling. It
Yeah.
definitely feels like, well, maybe it does exist in real time that we are, under assault. And so
Yeah.
I think it's really exciting and very powerful that we have people like you, and that we have who are able to share their perspectives, and like Katie talked about earlier, our storytelling, and people are able to share their lived experiences, because those are the things that's at the core of what helps to power this work. It's the thing that keeps us, going, that fuels us in being able to, do the work that we are doing collectively and together. It's not just the staff, it's not just our board, it's people, it's all our advocates who are writing letters to their senators, who are taking actions, when those texts and those emails go out. So thank you so much. I appreciate you sharing that. And it just really underscores, what this moment requires. So with that, I want to excitedly share with everyone joining today that Dr. Cook has made a generous investment of $10,000 to support Ren's work. And this $10,000 gift is also serving as a match for our Midlands Day campaign going on right now. So, what that means is every dollar that you give today will be matched and your impact will be doubled. So, Dr. Cook, we want to thank you so much for stepping in such a meaningful way and in this critical moment as well.
Thank you. And again, I want to challenge all of my fellow physicians and again, other patient-facing providers that are serving the communities across South Carolina. I know oftentimes you don't have time, but hopefully you have some giving ability that you would be able
Hmm.
to help support these efforts. And I'll be reaching out to some folks individually and trying to challenge folks to, you know, give it an opportunity, give it a thought, and make a
Hmm.
contribution. Because if we don't do this now, I fear that many of the things that we're fighting against are going to steamroll over us. And so now
Hmm.
is the time. I feel like we
Yeah.
need the power, we need the investment, we need the support of the community to try to maintain and even protect the rights that we've had traditionally in the past.
Yeah. And thank you for saying that because you said something very important here that I definitely want to emphasize is that it's not about, everyone giving at the same level. It's about everyone participating. So moments like this it's a collective power. It's powered by collective action. And when more people step in, it strengthens our ability to show up, to respond, and to lead. And just so my last question, for those who are listening right now who may be considering a gift, um, what would you say to them? And I think you may have touched on if you want to expand. What would you say to them, Dr. Beth, about why their support matters in this moment?
Uh, the fear that I have as
Hmm.
somebody who deals and sees many of the circumstances that we've been talking about and some of the stories that we've shared today, the fear I have is if we don't have that support and we don't have that broad range involvement and we don't have folks who are dedicated to writing letters and those who
Hmm.
can making contributions and doing things, then it gives others the feeling that they're entitled to take away our rights. And
Hmm.
I think it's so important right now. And in many avenues of your life, you find that there are some things that are worth fighting for. And I
Hmm.
feel like this is worth fighting for. And I feel that, like I said, WREN, excellent option for giving just because of all the involvement you have across the board, multifaceted approach, excellent in terms of, organizing and getting people present and getting people involved. And I don't think you could choose a better organization to make your contribution with. And I just
Hmm.
wanted to inspire my fellow healthcare workers to do the same.
Awesome. Wonderful. So we have some resources here, but before we close, I just want to say that everything we've talked about today, policy, advocacy, community, it only moves forward when people decide to step in and support it. So one of those ways we have listed here, Midlands Gives campaign. You could also go to our Action Center, um, our Storyteller initiative, which Katie spoke on earlier, and we also have advocacy resources, which are resources to help start your advocacy journey if you're very new to this. And Katie will be dropping those links into the chat for everyone to be able to go to those sites and be supportive. Um, so I appreciate Dr. Cook for showing what leadership can look like. And now this is an opportunity for everyone, for all of us to do the same, whatever level is meaningful, like Dr. Cook said. So, um, but the moment that we're here is because Midlands Gives is happening now through May 5th. And this is one of the most important moments of the year to support men's work. So if you haven't already, I do encourage you to take a moment before you leave today to make your gift. We've dropped the link in the chat, like I said, and it only takes a minute. Every single gift at every single level, it helps us to continue showing up for these moments and fueling this fight because it is definitely a fight that we are in, and it helps us to fuel that. Um, so I want to thank you, Dr. Beth, for being here, for being a part of this community, for being a part of this work. And now we want to open up the floor for questions. So if there's any questions that anyone has, Katie is sort of facilitating that. So, Katie, are there any questions that we have in the chat?
Not that I can see. I don't see any questions. I'm opening up our Q&A section just in case they're hiding.
Okay.
No, I don't see. You guys did such a good job explaining everything that everybody's got it. They're like, I'm gonna give $1 million right now. Um, but seriously, everyone, thank you. Anything you can give is very helpful.
Yeah.
But yeah, we're looking great in terms of questions, y'all.
Awesome,
Wonderful.
awesome. And Katie, not to put you on the spot again, but I know you're so you're so knowledgeable. If there's anything that you want to add or tell the people, as far as advocacy goes, anything that you like to add, and if not, that's okay too.
Guys, we are so close on so many bills. So if you're not contacting your legislator, if you haven't done that yet, I did put the link to our action center. There are, I believe there's 3 weeks left in the legislative session. South Carolina is a 2-year session. This is the end of the second year. So anything that doesn't pass at the end of this year is dead, and you have to start over next year.
Mm,
So again, our action links there. Just go through and just hit all of them for me if you don't mind. And we have bills that we need to make sure don't get heard anymore by the end of the year, like Senate Bill 1095, that total abortion ban, or 4760, which is that ban on or which is the restriction on abortion medication. Um, we need to make sure those stay still, and we need to make sure
mm,
the great good bills like Senate Bill 11, and Senate Bill 477 needs to get its conference committee. That one's really close. We need to, I think it's really easy for us to get caught up in the 1095s of the world, and forget about the Senate Bills 11. So
mm,
let's hold strong these last 3 weeks. We got it. We're in it together. Ren, we do it with you, not for you. And so we can
mhm.
only do it. We can only do it together. So take action, give if you can, and let us know if you have any questions after the fact. You can feel free to email me, and we'll get that answer for you.
Well, thank you for that, Katie. And before we become, sorry, come to a complete close. Um, oh, I think I might be muted. Oh, I'm not muted. You're muted. Sorry. Before we come to a complete close, I just want to ask you, Dr. Beth, if there's any closing remarks you want to make, anything that you would like to say to the people before we wrap up here.
Yeah. Give now while we can maximize your contribution through
Yes.
matching funds and other opportunities that we'll have by the amount raised during Midland Gives. So
Mhm.
in this way, your gift, dollar for dollar, is going to mean more because of the matching
Yes.
funds and the additional funds that we can secure through this event. So don't put it off. No need to wait till the end of the year. Do it now. And it matters. We need to be fighting hard now, and not when we no longer have our rights. So I encourage everybody to again, give it the level you can, either money, time, whatever you can become involved in is very much appreciated. And we have power together. And I think that's the thing that people forget sitting alone at home. You know, get out, network, get involved, be a part of the fight. So that's all.
Yes. Very well said. Well, thank you everyone for being here. Thank you for being part of this community. And thank you for all the ways that you support REN and this work.
And Dr. Beth, I just want to let you know, we got a question, more less of a question, more of a
Oh,
comment.
nice.
Just that you are super inspiring and thank you for everything that you do.
Oh,
So,
that's so sweet. Thank you.
so I wanted to end on that note, if y'all didn't mind.
Awesome.
Yeah.
Stop it. You're gonna make me cry.
Oh.
All right. Well, thank you, everyone. Take care.
Thanks. Bye bye.